If you have tried supplements and peptides and physical therapy and all these things and you are still not seeing significant improvements in your chronic pain, it's time for you to step up into a more targeted approach. Now look, I love all of those things. I love lifestyle changes, I love sleep hygiene, I love supplements, I love peptides, I love physical therapy. All of these things can help a lot of patients in chronic pain. But unfortunately, those things don't help everybody. And so if we start with 100 people and we put 100 people on lifestyle and PT and supplements, let's say 70% of them get better. Great, those 70 people are gone. We're left with 30 people. Now we take those 30 people and we put them on peptide therapy, and let's say 20 of them see significant improvements in their pain and they don't need to do anything else. Great, those 20 are gone. So out of the 100, we're now left with 10 people who have gone through and tried a bunch of things and they have not been effective. And so in a situation like this, I really strongly recommend you to start looking into interventional orthobiologics. These are things like PRP injections, stem cell therapy, nerve hydrodissection. This class of injections is targeted, meaning that as long as you're working with a good physician, they're going to figure out which structure in your low back, in your knee, in your neck, wherever it is, which structure is causing your pain. So that way they can deliver the orthobiologic directly into that area. And so now we move from a situation where, you're doing stuff that just kind of helps your whole body, helps you to be healthier. Maybe you've been doing some stem regen and you're mobilizing stem cells and all that stuff, but it's just not doing enough. Now we move into a targeted treatment where we are coming in with precision and we are saying this is the spot that hurts, so we're going to inject directly into that and stimulate a healing response. That targeted approach could be the difference between you having no improvements in your chronic pain and life-changing improvements. And so if you kind of feel like you're at that place where you're like, I feel like I've just tried so many things, it's sometimes better to step up a therapy than to continue looking for the next peptide, the next supplement, the next exercise program that's going to improve. Now, could you do that? Yeah, for sure you could. If you're, not ready to take that next step for injections, whether that's just fear of injections or it is a financial aspect, whatever it is, if you want to continue to look for things, all the power to you, that's great. But for those people who are like, man, I'm sick and tired of just not finding what's working for me, the interventional orthobiologics could be the next best thing for you.